my background is in orthopedics and neuroscience with a very strong rehab emphasis. So that is traditionally an area that's very focused on multidisciplinary care. I also, very early in my career, actually as an undergrad, had some really remarkable experiences that really helped shape the way I think about multidisciplinary care. For example, as a student nurse, which was a while ago, I had a very influential instructor. Bonnie Wesorick was a med-surg instructor here, and she taught a med-surg clinical. We all go through them. It's a very common experience in nursing school. But what I really learned in that experience that has carried me through several decades is the importance of, one, finding that individual thing for these patients. She had us do very specific exercises so that we could understand what this particular patient's need was, and how, although this patient may have breast cancer, which is a very common diagnosis, that they would have how they experienced it and what it meant in their life would be different from another person. I can remember specifically doing meditation with a patient, and understand this is 30 years ago. It's a fairly common practice in healthcare now, but 30 years ago that would kind of be considered a little on the out there side. But she suggested, and I thought, well, we'll give it a try. And being able to see the physiologic parameters change, the blood pressure changes, and the heart rate changes, and the descriptions of feelings of well-being that this patient was able to give me was really eye-opening to me. And then from a multidisciplinary standpoint, doing things like having us have experiences where we truly tried to, or had experiences with other disciplines. My particular one, for some reason I remember, was with pharmacy, which I think is really funny because here I am all these years later teaching pharmacology. But I remember going down to the pharmacy and really getting a look at how their world was different and how we could really help each other with our work and with improving patient care. And I thought that was pretty remarkable. And at the time, being an undergrad student, I'm sure I just thought it was an assignment. You just do the assignments and you don't really understand how they fit within the context of your nursing career until all these years later.